Hi everyone, I'm Jasmine, or some of you may know me as Jazz. Um, I am actually making a lupus awareness video. This is my first video in honor of my third Lupusversary, which was last month. Around September of 2015, I was diagnosed with lupus and mixed connective tissue disease. My goal is just to kind of educate people a little more on lupus. It's not really a common disease that's talked about a lot or heard of a lot. And it has become, in these 3 years, dear to my heart to spread knowledge and spread awareness about the disease. So bear with me, guys. This is my first video, but I do see the importance of spreading lupus awareness. Also, I do receive a lot of questions and concerns regarding lupus on the regular. A lot of people have some misconceptions about lupus. Lupus is very, very tricky. It ranges a lot. There are people with lupus that are completely okay. They may just suffer from skin rashes or some of the more mild cases, and then you have people that suffer very, very greatly as far as if the lupus attacks their organs or tissues or things of that sort. So that kind of leads me into what lupus actually is. Lupus is an autoimmune disease in which your body is, in so many words, hyperactive. So it attacks your organs, tissues, any foreign things that are coming and going in your body. And when I say all organs, I mean everything from head to toe. So again, lupus ranges. It's on a very, very wide spectrum. You have people that it may affect something as far as their skin, or like me, lupus affects my heart. I've had some long involvement with lupus. It mildly affects my skin. I do have a few results as far as with an inflamed liver and things of that sort. So I've had some different issues with lupus. It does affect all of us differently. So not only does lupus affect us all differently, lupus also presents itself kind of tricky and differently as well. A lot of people will say, oh, well, like, were you born with lupus, or what exactly, how did lupus present itself? And for me, it's kind of tricky. There's no definite answer with that. I can honestly say, for as long as I can remember, I've always known that something was off as far as my health. And I say that because I think that my first memory of just something just being wrong was when I was around 6. I think I was around 5 or 6. And my parents had taken me and a younger cousin of mine to SeaWorld. And the only thing that I remember about that trip is that I woke up to my parents and like the paramedics trying to like get me to, to like wake up. I guess I had fainted. And ever since then, it's just like I wasn't able to be very physically active. Like, my family would always joke around with me that I was allergic to the sun. And now I know what that is about. Having lupus, you're pretty much allergic to the sun. You really are not supposed to be out in the sun, really outside a lot, or even around certain lights. It brings on lupus flares for some reason. And with me, that's like one of my main issues. So I kind of went through my childhood not really being able to be physically active very much. I would always get really sick or faint or dehydrate, all of those things, etc. But with that being said, I just kind of avoided doing things, where I would be very physically active. And thankfully, compared to like other people that I've talked to who were diagnosed with lupus as a child, I just did not have any other signs or symptoms other than I would just get really, really sick or fatigued in the sun. Like that was it. Um, at like 20 or 21, I think this was in 2012, I had an incident where I thought that I was suffering from anxiety, but it comes to find out that I was having tachycardic episodes with my heart. And so what that means is my heart rhythm beats like really, really, really fast to the point where I can't get it on pace. And so actually with this incident, my roommate was able to take me to the hospital, and what they found was that I have a heart disease called HOCM, which is hypertrophic obstructive cardiomyopathy, which again just means that I have tachycardic episodes and my heart rhythm is a little more, it races, or just is a little more racy than the normal heart rate or the normal heart flow. So that was about in 2012, and I had a heart cath done there then, and you know, they didn't find any obstruction or any blockage or anything like that. The only thing that they were able to tell us is that my heart muscles were thicker than normal, and that was just it. I was, you know, after spending like 4 days in the hospital after having that procedure, they let me go home, and we really didn't have any answers from there. I was medicated with a beta blocker or heart medicine just to kind of regulate my heart, but I didn't have any extreme issues as far as that any further. In 2014, my cardiologist decided to do another heart cath or an electrical study, and from that it was the same thing. We found that ultimately they just couldn't figure out really what was wrong. Why was I having these tachycardia episodes? And so now looking back, there were a few things that kind of allowed me to start putting some things together. At this time, I had been watching the Braxtons, in which Toni Braxton has lupus, and her lupus affects her heart as well. And so I'm like, that's kind of weird. Like, you know, I don't really have most of the signs, or back then I didn't have them yet. But I was like, I kind of wonder if there's something that I need to kind of ask my doctor about or whatever. So probably like a year or so goes by, and maybe around like April of 2015, I started noticing that my joints and stuff were swelling. Like, as most of you may know, I'm kind of a thinner person, and my fingers were just like starting to swell out of nowhere, and I'm like, that's kind of weird. Like, I don't know why my fingers would be swelling out of nowhere. And then maybe by like May, I started having like muscle weakness. It was like really, really hard for me to walk, or when I would try to get up and down, like out of my bed or out of the chairs, or like even use my arms, doing my hair, brushing my hair, all of these things were just like, I was in pain from just doing the simplest things. Also, I had like a fever for like a month, and I had no idea what it was coming from. And I don't know, I guess like I'm just a little like goofy. It just didn't dawn on me that something was wrong. I thought I was literally like waking up and changing my clothes like 2 to 3 times during the night. Like, I would wake up drenched from these fevers, and I had no idea what was going on or why. Also, when I would wake up in the morning, wherever I laid down that night, I was hurting from like head to toe. Just suffering from like muscle weakness and joint pain and stuff like that. And so finally, it was probably around like August of 2015, I went and saw a doctor, and he was so surprised that I hadn't been diagnosed with lupus before. He pretty much had told me that I was suffering from an autoimmune disease. He didn't know if it was lupus, fibromyalgia, rheumatoid arthritis, or whatever it was. But he pretty much told me right then and there that he knew that I was suffering from an autoimmune disease. So with that being said, a lot of you may not know this, but when it comes to like chronic illnesses and stuff like that, it takes a really, really long time for you to actually see someone. We don't go to normal doctors. We go to specialists, in which the specialist in the autoimmune disease is a rheumatologist. And I remember I wouldn't have been able to be seen by a rheumatologist for months. I think that they had gotten me an appointment in like December or January, and this was August. So unfortunately, I actually had to be hospitalized before I could even get a proper diagnosis. What happened was in early September of 2015, me and my family had gone to a Gator game. And, you know, if some of you know how that works or have been there, or just any field in general, you know, you have to walk up those hills and walk around the stadium and all that stuff. So long story short, that whole experience put me in a lupus flare. And when I woke up the next morning, I could not even move. So my mom had forced me to go to the ER, and from that day on, it's just been just a circus, a very interesting sequence of events. And so around that time, I think I was in the hospital for about 9 days. At that time, now looking back, it's just kind of like a complete blur. I could not walk, I could not use my arms, any of those things. You know, I had to be helped to the bathroom. I could barely feed myself. I was so weak. My body was so weak. I wasn't able to really do anything other than just lay in the bed. I was on high doses of steroids, high doses of pain medicines for like a week and a half. And so at that time, again, I was diagnosed with mixed connective tissue disease. And just to cover that, I think that more than anything, that's what confuses a lot of people. I actually don't know a lot of people with mixed connective tissue disease. I do know a few people that have lupus, but my primary disease that I do have is mixed connective tissue disease. Lupus is secondary to that. So in so many words, I kind of have a double whammy. And that's why, compared to maybe someone you know that has lupus, my situation is a little different. And I suffer a lot differently because, again, it's kind of like a double disease that I'm suffering from. So I briefly mentioned steroids, high doses of steroids, and that's kind of like the treatment of choice when it comes to lupus. When I'm in the hospital, I always have to get high doses of steroids. For some reason, steroids is just something that they use to treat when we have lupus flares. So I'll take the time to kind of go over some of the most common treatment options when it comes to lupus. The last 3 years I have been on steroids, a steroid called prednisone. It kind of depends, my dosages fluctuate as far as how well I'm doing. My normal range is between 10 to 15 milligrams a day. If I'm having a lupus flare, my doctors will go all the way up to, I've had like, actually last week I had to get an infusion of 120 milligrams, but sometimes I even have to get the milliliters from like out of an IV bag. So it depends. I hate prednisone. It makes me really, really sick. It makes me very, very fatigued. And that's something that, you know, when you have a chronic illness, not only are you battling the illness, but you're actually also battling a lot of the symptoms that come with taking such high dosage of medicines as well. When I was first diagnosed, I was put on a medicine called Cellcept. which is a medicine that's an immunosuppressant. And so what that means is that since naturally our bodies are hyperactive and attacks itself, they will use immunosuppressants to suppress our immune system. So generally our body will stop attacking it. So that was Cellcept. I was allergic to Cellcept, so I couldn't take that treatment option anymore. And that's kind of a funny story because my family, they're always like so supportive and they don't want to do anything to like hurt my feelings or anything like that. And I knew something was wrong because I was starting to get these like warts on my face and just like hives and stuff like that. And I was just like, are y'all sure? Like, you don't think something's wrong, or like, you know, I look weird? And they're all like, no, you look great, like, no. And I'm literally allergic to the medicine. Like, I had like warts all over my face, so clearly something was wrong, but they were just like trying to just, you know, be supportive and be there and all of that. So with that being said, obviously I couldn't go around here looking like Fiona from Shrek or whatever. So they put me on a medicine called Imuran, and Imuran is a chemo actually, but it's an oral chemo, so it's a chemo pill. The Imuran didn't really do much for me. My issue is that my body becomes immune to a lot of things, or a lot of the treatment options. So it would help me to like a certain degree, and then it just wouldn't get me to like remission. Like, it just, like my lab results and some of the things that you look for as far as autoimmune diseases and stuff like that, it would kind of go down like a little bit, but not to the point of, you know, where it needed to be or back to normal, or, you know, for the average person. So they tried me on something different called tacrolimus, which was, that medicine and is actually a organ transplant rejection drug. And that's also a treatment that's commonly used as well, because for some reason it slows down your immune system. That medicine gave me more problems than it helped. It gave me lots and lots of symptoms as far as with my lymph nodes. I would always be like really, really swollen. My lymph nodes would be really, really swollen. And even the lymphs in like my head, I would get like knots and stuff like that on my head. I would have sore throats all the time, fevers. That medicine just did not help me at all. After that, I started methotrexate, which is another chemo, but it's an injection. So I had to inject myself. I actually started that last year, December, and I took that until like May. And that is, again, it's a chemo, it's an injection. I had to inject myself on a weekly basis. And it was the same thing. It just helps me to a certain degree, and then it's just like, it just halts itself. Also, it gave me really, really, really bad vomiting and nausea symptoms. I literally vomited for like 3 months straight. Anything that I would take in, it was coming right back out. So I actually took myself off of that. So that may be something that my doctor may have me get back on again. We'll see. But also, along with the methotrexate, right now I'm on an infusion treatment called IVIG globulin. And what that is they are fake antibodies. The antibodies are actually grown in mice. And what I do is I go in and I get it from like an IV bag on a monthly basis. And the antibodies are supposed to like replenish the ones that I have already, because my body attacks them naturally. So I do that once a month. And what else am I on, guys? I'm actually on a medicine called Benlysta. So every other medicine that I just mentioned, or every other treatment options, none of them are actually designed for lupus, to treat lupus. These are medicines that are designed to treat all different types of things. But fortunately, these medicines and these treatments do manage or control lupus. And so that's why when you have a chronic illness, you know, you take these things. So a lot of people get confused sometimes with chemo. Chemo is not used just for people who have cancer. Cancer patients do not own the name chemotherapy or the treatment of chemo. They just commonly are known as far as that being their treatment option. But chemo works to suppress the immune system for people that have autoimmune diseases. But Benlysta, which I just started a few months ago, it's also an injection. It is the first and only medicine that is specifically made and used to treat lupus. Right now, and I wish that I could say that things are going great and I'm in remission and my lupus is controlled or managed, but it's not. And that's just something that comes with this situation. You know, I'm not the only person suffering from a chronic illness, and I know that other people can relate to, you know, getting your hopes up or thinking that, oh, you know, when you get your blood work back, it's gonna be, you know, your results are gonna be good and this and that and blah, blah, blah. And, you know, I was looking forward to that with it being my 3-year Lupusversary, but that just didn't happen. And, you know, that's okay. I've been down probably the last 3 or 4 weeks. What happened was I picked up something viral, and this actually happened to me around last year, around November of 2017. I picked up something viral, and it just had started to give me issues as far as in the lungs and in the airway. And I literally just could not breathe. I couldn't talk without barking like a dog. My blood pressure has been low. My heart rate has been like in the 120s. So, you know, I've just kind of been going through this month. But with lupus, you honestly just have to be patient, and you have to just kind of keep pushing forward, because I have months or I have weeks where it's just terrible, but then again I have months and I have weeks where I'm okay. So, you know, you can't let it get to you too much, because at the end of the day, it's always, a lupus flare is always going to pass by. So, you know, you just have to do your best just to be optimistic and to just continue to, you know, just keep pushing forward. That's all. So that's just a little bit of an update of where, excuse me, of where I am now with the lupus. Actually, I forgot to mention that I'm also on something called Plaquenil, which is a common medicine for those who have even like arthritis, RA, lupus. I think people who suffer from psoriasis are on Plaquenil as well, which is another medicine. Plaquenil is actually like anti-malaria medicine. So, you know, how that came into effect of treating those with autoimmune diseases and stuff like that, I have no idea. But that's like my daily, prednisone and Plaquenil is my daily medicine or treatment option. And everything else is just kind of something that I have taken just to see again if we can get, you know, my lupus managed or controlled. There is actually like one more treatment option left for me, so I hope that it works. And that's actually called rituximab. So that may be something that I'll be incorporating as far as my treatment options soon. And so one last thing I just kind of wanted to do is just to kind of give you all like some tips for those who may be suffering from lupus or any type of illness or disease or anything like that. And also for those who, you know, may have maybe friends or family, you know, if you're just kind of looking for some ways to support, always just do your own research, because a lot of you may not think this, but the hardest thing as far as having these issues is socially, it's so awkward sometimes. Like, probably like my first year or so, I just try to like avoid people, avoid conversations, even still now, because it's just weird. Like, I don't like to think that that's the first thing that comes to people's mind, like when they see me or if they're like talking to me. You know, I'm still just a normal person. um Again, socially, it's just hard. I suffer from fatigue a lot, so I don't really do anything that I used to do. I don't go out, concerts, parties, whatever the case may be. I'd have to really be feeling like well to do any of those things. So socially, of course, my life has completely changed. But you know, if you have a friend that's dealing with lupus or something like that, just try to be supportive. Just try to understand that we just don't have that energy to do those things, you know. Don't say things to make them feel bad, like, oh, like you're lazy, or, you know, like that's, no, don't do that. Someone with lupus hearing that they're lazy will literally like, no, don't say that. So, also, just try to research and just try to allow yourself to become knowledgeable of things yourself, of treatment options, or just like trying to understand how lupus comes in different ranges. I've had a lot of people say like, oh, well, I know like this person that has lupus and they're fine, or like they can do this or they can do that. Again, no one with lupus wants to hear that. Definitely if they're suffering greatly, and in so many words, to us, it's like you're trying to say, oh, well, you know, like, are you like a hypochondriac, or like, are you really suffering? Are you really that sick? Or like, you know, so that's like really, really hurtful, because I mean, I don't think I can point out one person that I know that could deal with what I deal with on an average daily basis. So it's just something that, you know, as someone suffering with the issue, I don't really appreciate someone coming at me like that. So that's another tip just to keep in mind. But as far as lupus, you know, I'm always open to any questions that people have. I'm not super sensitive about the situation. If someone, you know, wants to reach out to me and know a little more about this or that, I'm always willing to educate you on whatever it is that you would like to know. You know, and I'm hoping, this is my first video, but I am hoping that I can kind of spread some awareness and just get the information out there. If you guys want to, you know, hear a little more about specifics, or want me to touch on specific topics, I'll be willing to do that. You know, just let me know what you guys have in mind. But I do thank you for taking the time to listen to this video. And hopefully you'll be seeing more of me soon. Thank you. Bye, guys.